First and foremost, I think you have to look at, and how it will often manifest itself is before the delivery even occurs. So it involves failure to manage, assess in the first instance, and then manage, whether by medication or otherwise, maternal risk factors and maternal conditions, whether we're talking about preeclamptic conditions, maternal infection, gestational diabetes, anemia. There's all sorts of maternal risk factors, maybe just advanced maternal age, that may be causing certain other issues that are discoverable by ultrasound, whether you're talking about intrauterine growth restriction or otherwise. So I think first and foremost, it's assessing and managing maternal risk factors and conditions. That's initially, and then you deal with the delivery itself in terms of properly managing it. If a child, or if a mom comes in and the child is premature, there could be medication errors or administration of medication issues that you need to look at on whether or not the proper medications were administered with the appropriate frequency to hold off contractions, so that the mom did not deliver a premature baby that carries with it a host, in and of itself carries with it a host of potential delays and developmental issues with a child. Certainly looking at how the delivery occurred in terms of the surgical techniques used in delivering the child. Was it delivered through a vaginal delivery? Well, if it was a vaginal delivery, then depending upon how the fetus presented on the ultrasounds most closely related in time to when the delivery occurred, there are certain uterine incisions that should be employed that will maximize an obstetrician's ability to deliver the fetus. So you could look at that in terms of a vaginal delivery. Should the vaginal delivery, based upon risk factors, been converted to a C-section delivery? And the timeliness of that is critically important into delivering a healthy child. Did it require instrumentation to deliver the child? And if it did, what were the reasons precedent to that caused the instrument delivery to have occurred? Could it have been prevented? Because instrument deliveries carry with them, in and of themselves, a host of other risks. Did they fail to diagnose upon admission into the labor and delivery unit maternal infection that could have a devastating impact upon the health of the newly born child in terms of the delivery? So there are a host of factors, both including before the delivery, during the delivery, and after, that could result in different types of malpractice that occurred. In and of themselves, they're all considered birth injury cases, but they are extremely complicated, very complex, very nuanced in how the investigation needs to occur, into delving into and developing whether or not any of those missteps or any of those issues are attributable to a birth injury occurring.